When the red panel goes up, don't make us go get a hook and take you down, okay? All right, who would like to, I'm gonna ask, I want to recognize two people first. Bishop Richard Cox, and then one of our city commissioners, Daryl Fairchild, is one of the city commissioners, one of three, that signed in opposition, in favor of getting a new medical center built. And so I want to be sure that I give both of them the mic, and then we will open it up past that point. And welcome to Reverend Dr. Rodney Carter, former president of the CCC. Dr. Carter, please take your seat up here. Any other pastors, leaders who have already signed the letter? Reverend Fairchild, Commissioner Fairchild, would somebody hand the mic to him, and we'll take him first. And then we will give Mr. Reardon two minutes to respond as he sees fit.
I just want to make a few comments. The first is to acknowledge the work of the Concerned Clergy Coalition. Your persistence and endurance is remarkable, and the community is in your debt for that work, and I continue to look forward to working with you. Also, Mr. Reardon, I want to thank you for coming and being present. My roots are in community organizing, and so this event does me good because it feels like I'm home. Because I look around here and I've rubbed some shoulders with all of you and done this work with you, and so thank you for this hard work of this community. Seeing that the video and the presentation reminded me, and I had forgotten about this, right after the announcement of Good Sam was closed, my wife and I, who live not even a mile from here, received a mailer from Premier Network, and it talked about the importance, I kid you not, it talked about the importance of having access in healthcare in your neighborhood. And it was promoting new centers that were opening in Inglewood and Vandalia. And I had forgotten about that, and I'm curious if I had put that flyer into a folder to hang on to, because it just struck me of the disconnect about the needs in our community. I know there was some frustration with the city commission and the mayor and the commissioners at the time of the closing. I'm not sure that I couldn't find the mechanism that we had to impact the decision because of the nature of the corporation of Premier and our relationship with them in the city. In the plan going forward in Phoenix Next, the city's a partner. I didn't see the city named up there, but we have a relationship with Premier in terms of funding Phoenix Next. And so I think that the city has more of a role to speak and have influence in this decisions going forward. And then finally, the question I have in the midst of this is, hospitals are supposed to have community health needs assessments. And I'm just curious what the current community health need assessment is that Premier has, particularly for this area of the city. I think that's in a 3-year cycle, so I'm not sure where we are in that cycle, whether it's been recently completed or about to be re-looked at. But it seems like any decision going forward should be guided by that document, by that assessment. So.
All right. So the question was specific around the community health needs assessment. The Commissioner is correct that is a requirement, a federal requirement, that we prepare that, and I believe it is on a 3-year cycle. I'm not sure about that. Still closer. So we will do that. We're mid-cycle right now. We'll do that. So I like that idea. I think it's very important. So that's one touch point. The other touch point I mentioned when I was up there was on the strategic plan. This is another opportunity for us to get input to see what are we going to do over these next few months. We're going to do what we call an environmental assessment. It sounds very technical, but it's just understanding what the market needs are, what's out there in terms of the physicians, the physician needs, the patient needs, et cetera. The third thing I'll say is that we are a large organization. I report to a board, not a board of directors, but a board of trustees. So the assets of Premier Health are at a trust of the community, and there are trustees that are appointed to oversee that. One of the key committees of that board of trustees is the community health. And we do look at areas like this and other areas to make sure that we're following up on the needs and needs assessments.
I'll be brief. Thank you, Mr. Reardon. I was the one to ask you to come to do the town hall, and I thank you so much for coming. From the county to the city to the state, they said that racism is a public health emergency. And it is an emergency in Northwest Dayton. And I want to just briefly share a story with you. I'm a foot soldier. I was on the Edmund Pettus Bridge with Dr. Martin Luther King Jr. So I know the sting of racism and the hurt that it brings upon those people who feel like they've been locked out. But why am I so passionate about seeing adequate medical care on the West Side? Is Good Samaritan saved my life. 10 years ago, my kidneys were operating at 35%. I'm a chronic diabetic. I have congestional heart failure. I have high blood pressure. I have 4-stage kidney disease. They were going to put me in a nursing home. I hadn't walked in 21 days. When I got to Good Samaritan, they found out I had a blood clot. And they found it. And they saved my life. I'm not in a nursing home. That's been 10 years ago. Had it not been for Good Samaritan Hospital, I would not be here. So I'm saying to Mr. Reardon, understand how devastated this is in our community. And since you're building state-of-the-art medical facilities everywhere else, what you've done in those communities, we're asking that you do in our community.
Thank you, Bishop Cox. And Bishop Cox is right. He did ask me to come, and I accepted. Him and both Dr. Wood and I think it was at a caravan meeting, a group of the religious. So as I understand it, so the question, can we do something in this community? And I hear the comparisons to others. And then I also hear, so I'll say yes, and I also hear how for many in this room that's lacking. But I'll say yes. And that is that 50,000 square foot site. It will have medical facilities. It will have urgent care. It is a project that I fully support and have demonstrated that support, and the board has demonstrated that support by accelerating funding, by making sure that when we talk to our partners, they knew of our commitment, that we would go forward with that, and we think that urgent care is really important. When I mentioned earlier that I had the opportunity to see that video, so the second time I watched it, I think I have a recollection. I either forwarded it to some of my direct reports, we watched some of it in one of my staff meetings to go over that. And when I said, listen, let's look at what we're doing and planning in Northwest Dayton from a slightly different lens. So right now, as you look at the facility, yes, I like that we have an urgent care plan there. But it seemed to us, as we looked at it again, that the current plan locked us in a little bit. And it's my prediction that once this gets started, and it's looking at more than just urgent care, wellness, the whole person, that this will be a terrific thing. But I said, let's reorient it so that we can grow. So that let's predict success, and let's reorient the building so that in a couple years when we say, gosh, this is really going well and we need to add services or we need to add whatever that might be, we're not saying, gosh, why did we position the building that way? So we actually, as a result of our meetings, shifted our planning and accelerated and bolstered what we were trying to do. And I'm glad that is a project that's been approved through the different planning through the city, and it is one that has my full support.
Okay, we'd like to take a question for the floor, from the floor. Yes.
Good afternoon, Mr. Reardon. My name is Rebecca Holbrook, and I'm new to this area as you are, and I knew that I recognized your name. I am a medical professional, have been for more than 40 years. Much of that time I spent at the University of Chicago. And I understand, as you do,
Did you say University of Chicago?
the University of Chicago Perinatal Center.
Ah, great.
I was a community liaison for much of that time. And the arguments that I heard at the University of Chicago are the same arguments that I'm hearing here. It is the quality of medical care and the needs of these communities that your hospitals serve that must be addressed. The thing that I learned at the university is that it is easier and less expensive in the long run to take care of low-income people and poor people than it is to let them use the emergency rooms as their primary care provider. I've only been in this community for about 18 months, but I recognize from my own experience that I had to drive all the way out to Austin, that area out there, just to go to an emergency room that could provide the kind of care that I needed. That is totally and completely unacceptable. These people need medical care. We need for our babies to be born healthy. I've watched them be born unhealthy in the neonatal at the University of Chicago. And I've seen people here who have had strokes that didn't get to the hospital in time enough to get the medication so that they could avoid all of those additional circumstances that happen to people. We need medical care. We need it in a hospital. We need a full service emergency room. And we don't need clinics that are going to close at 5 o'clock. And then we got to go way downtown to Miami Valley Hospital in order to get care. I can say a whole lot more to you if I can get you by yourself.
Would you like me to compare and contrast a little bit the University of Chicago and here and sort of try to fill in some of that, or is there a specific question you want me to?
I want to know if you can use the experience of working at U of C and in the Carolinas.
Yes.
Can you apply that here and make us move forward and better?
Yeah, all right, so the answer to that is going to be yes. So let me talk a little bit about that, and I'll talk first about the University of Chicago, then I'll talk about what attracted me here, and then I'll talk about sort of what moves us forward. So the University of Chicago, so I don't know what years you were there, so for me it was...
I was there when you were there.
I was better looking back then, and you look the same, I'm sure. That was a big learning experience for me, and it's a learning that I took to coming here, and so you also may remember that my vice president that I hired for community affairs was the First Lady, Michelle Obama.
I worked with Michelle.
She worked for me when we just knew her husband as, you know, he might have been a state senator, but certainly as Barack Obama, just sort of look now. And what she taught me is that when you approach a community, you approach them assets, and you go through the churches. That was very significant in the African American community. So that was a big thing. One of the things I will say about the University of Chicago is that, like some other universities, you know, on the south side of Chicago, one of the largest areas of contiguous poverty in the country, they didn't pull away. Now, they may have built a moat, and sometimes it felt that way, but they didn't move to the suburbs. They stayed engaged with the mission and with the community, and that's something that I certainly tried to do as well. Our NICU there at University of Chicago was as big as the NICU here. And so I'll talk about the NICU here in a second, but here are the learnings that I got from her and that community engagement that I think is really important. And I'll also say is, when the University of Chicago tried to close their trauma program, that was after myself and the First Lady left. All right, so I'll tell you that. And they went back and reopened it, which I think was the right decision. When I was being recruited here, a lot of people say, well, why did you come to Dayton? I'd never really heard of Dayton, but I knew a person who knew me, who had placed me in another organization, says, Mike, there are so many things about Dayton, believe it or not, that are going to remind you of Greenville, and also of the University of Chicago, and I couldn't believe it. When I got here, I did believe it. The big thing for me, and I love all of my campuses, is Miami Valley Hospital. There is nothing like Miami Valley Hospital on this half or 2/3 of the state of Ohio, to include Indiana and Kentucky. Nothing like it. There are helicopters, there's a training program, and I'll talk about that, and the teaching. And I just toured, so it's very timely, just last week, the NICU. One of the busiest NICUs in the country, right here. That expertise is collected, aggregated, and right there for when it is the 5,000 births at Miami Valley Hospital. There is nothing like Miami Valley. If this had just been a community hospital system, you'd be talking to somebody else right now, or not. But for me, that was just sort of critical. So we'll get to the sort of the teaching and the education. I think there's an opportunity for us to work with, so we have 125 residents that are from the military. We help keep the Air Force and the Army mission ready. They come through our emergency room. We have about 150 other residents and fellows. One of the fellowships we just started, and this will be funded by us, is going to directly help the NICU, and it's an addictionologist, or an addiction residency that will really help sort of moms and babies as we go forward. Those of you that know the academic side, and there probably are a few admissions here, no, that's not where you make money. It's what we have to do. So I see the red light, but thanks for asking that, and I'm glad you wrote the show.
As we bring our next person up, I just want to say that let us be clear when we are talking about things, what we're asking for. We're not asking for an urgent care. We're not asking for an urgent care. We're not asking for any yard 2 or 3 years from now. So I said when we're asking questions, we want to be clear what we're asking. Is that not so? That's right. Dr. Carter, former president of the CCC, I want to ask him to. Yes, please.
First, I just want to thank God for this assembly tonight. It's really critical for what this community needs. I thank the community for coming out. Thank the work of the CCC for never giving up. I want to just, I really need you to not put me on the 2-minute thing. Can I? I'm saying that Dr. Brown, you can't do it in 2 minutes. Hey man, all right. But I want to say this. All the while we were advocating for the people on the west side for equity and equality in healthcare. It was an uphill battle. We knew it would be, but I'm extremely disappointed. I'm extremely angry in regards to the response of Premier Health, especially in the continuing to build in white suburbs at the expense of African American community here. As a lawyer, we understood it to be in mediation, so we understood it to be in our direct contact with HHS, a total violation of the Civil Rights Act of 1964. The language was clear. We understand the work that Premier did in hiring people who had influence. We also understood that the partnership that they had with the city of Dayton, the county, the city of Dayton is also culpable, amen, because they are partners in this, amen. We were able to get $10 million carrot that they dangled in front of our face. Once they got bankrolled by the county to the extent of $590 million, they then upped that from 10 million to 15 million. Oh, how gracious of you. The city immediately, the former mayor immediately matched that. So we went from $10 million to $30 million. $30 million is enough to build an adequate medical center on the west side of Dayton. So they had the money. They had the money. And I didn't understand, I still don't understand, and it baffles me and it angers me at how you can build a medical facility of 60,000 square feet in Beaver Creek that includes offices and imaging, all the things that we're asking for, and a standalone emergency. You build a standalone emergency in Austin Landing when there's no need for a standalone emergency in Austin Landing. But you do it anyway. I understand it. What I do not understand, and it bothers me even to this day, and I had to make sure that I had to learn from my friend on how to be angry. I always played the diplomat, I did, and I'm angry. I always held my anger in, but I'm angry. I'm angry at how our people, everybody else can get 60,000, 50,000 square feet, medical facility, everything, and we get an urgent care. I'm sick of it. If it's not racist, somebody tell me what it is. Okay, now I know that my friend, Brother Reardon, had nothing to do with that. He's just coming in, and I'm sorry. But I appreciate his courage for being here. Okay, but I'm speaking the powers better and more than him because we have to stand as a community, and we cannot accept this. Okay? If you can build a standalone emergency in Austin Landing when there's no need, if you can build a standalone emergency in Beaver Creek, you can build a standalone emergency for the trauma that we suffer on Friday nights and Saturday nights in West Dayton. And I'm going to leave you with this. You have the money for a multi-billion-dollar entity. So we can't use running around with scarcity and you don't have the money. You are demonstrating to us that you have the money because you're on an unprecedented spending spree everywhere else. Where are the charts? Where are they? There they are. They're in my office. Building everywhere with all that money. And so we're asking just for some compassion. That's and some equity. If in fact you are building everywhere else, and you are,
Amen.
Why can't you build this facility for the people that you've abandoned by closing down a functional hospital, by deploying 1,600 jobs, by then destroying the facility to further exacerbate hopelessness in this community that suffers from scarcity and suffers from being a desert. Why? Because you're disinvested in it. I would be a desert too. Centerville would be a desert. Beaver Creek would be a desert if you shut off the water the same way you shut off the water in West Dayton.
Amen. Amen.
I want to say that, please, with compassion. Again, if you can build a standalone emergency in West, if you can build a standalone emergency in Austin Landing, and you can build a standalone emergency in Beaver Creek,
Amen.
you have to build a standalone emergency in West Dayton.
Now look, we're going to be fair, unlike presidential debates. So I think we gave it, Dr. Carter, an extra minute or two there, so we give you an extra minute or two, Mr. Reardon. Amen.
I was hoping he had one of my minutes. and for those of you that might have found that joke offensive, listen, under stress I sometimes make, it's how I grew up, jokes. This is very serious to me, and I can sit with people's anger. And anger is good. Anger is actually a good emotion. It's righteous anger. Because it gets action and it gets movement. So I can appreciate that, and I will sit with that. And I can say I'm here now. That's all I can say. I'm here right now. And I am committed, and I hear the desire for more. I have a prediction that that desire and that need will manifest itself. But right now, what we have is a commitment to the urgent care. And I hear that that's and that may rise even more anger, but I believe that will be successful, and we'll be able to move forward with that. And it's urgent care, it's lab services, it's PT, it's medical imaging. I don't want to minimize it. You may disagree that it's not enough, but what's there is substantive, and my commitment is for us to continue to look at that. I think it's going to be so important to get it up and running, and then if your prediction is like my prediction, we'll be able to do more in the future.
We don't need another urgent care. We do not need another urgent care. We need the hospital. I know you all already have your plans, but that is not enough. We need more than that now. We don't have much time left.
This is what this is for, to make your voices known, because it's been shared with the media, it's been said out there that we're fine, this is what we want, we're happy. As we can hear, we want to be sure that you speak your mind, let them know what won't work. This is a life and death decision.
Mr. Reardon, my name's David Israti. I've been an activist in this community for a long time. I'm currently running for Congress. And I got bad news for you. This isn't the first time Premier has done this. Okay, there was a hospital right across the river called St. E's. And when it sold, Premier spent millions of dollars to go in there and destroy all the medical equipment, the x-ray machines, the electrical, the plumbing, to make sure that that building could not be used as a healthcare facility.
That's right. That's right.
You put a restrictive covenant on the building. You didn't put it up for sale. You didn't open it up to somebody from Columbus coming in here, because what we have in this community is a duopoly. Now, they built a brand new emergency room and everything your competitors did in Beaver Creek, less than a mile away from where you just put another emergency room. This isn't about healthcare for our community. This is about you making money. And the problem with this is two words. It's called antitrust. And if I was in charge, which you better not, you better hope real hard that I do not get elected, because there will be no more $3 million paychecks for CEOs of nonprofits. Because Mary Gonzalez was not working for us. She was working for herself. And you're probably going to do the same thing. And the sad thing is, politicians are cheap and easy to buy in this community. And that's why you now own our fairgrounds, which you have done nothing but turn into a grass field. There was a man who wanted to spend at least $250 million there to develop it, and you and UD worked together to say no. How many times can I tell you that this shenanigans of playing the major employers by buying off our local politicians and saying you're doing it for our own good, and then they get the money put back into their campaign coffers by your PACs and all your employees? This has got to stop. Yes. We don't need a hospital, an emergency room a mile away from another emergency room. We need hospitals here. Yes. And let me say one more thing. As somebody who takes care of a service-disabled veteran who's 100% disabled and mentally ill, your mental health facilities in this community for inpatient are the worst I've ever seen. There are not enough beds. It's churn and burn. You are not serving this community, and people don't want to have to drive across town just to go see their friends that are locked up. Okay? We got to fix this, and we're not fixing it your way. We're going to have to fix it our way. You didn't have rights to that building. That building, Good Samaritan, was paid for by this community, just like your building is paid, because you don't pay property taxes. And maybe if you want to make $3 million a year, you ought to, out of your paycheck. This has got to stop. Yeah. Thank you.
Thank you.
No, that felt more like a statement than a discussion.
It's up to you whether or not you want to respond.
I'm good.
Okay, I'm told that Commissioner Shanice Turner-Sloss is here. I want to acknowledge her also, because she is one of our city commissioners that did stand in support with us. You're welcome to take a seat up here. This is important. We're acknowledging people because we have gone to city commission meetings, we have gone to county meetings, we have tried to meet with all of our local and state officials to try to get their support. So those who sign on with us, we want to acknowledge them. Okay. Yes.
My name is Father Satish Joseph. I'm the pastor of 5 parishes in the east side of the city.
You can take off your mask so we can hear you on there.
The racism in this has got to be acknowledged. And I don't think we acknowledge. We've heard about redlining, we've heard about white privilege, the racism in all of this has got to be acknowledged officially. And I think it doesn't have to come from the top. People are telling you that there is a racial influence. I mean, highways and railway lines and bridges and now hospitals are part of the redlining, and this is affecting lives. The second thing is, I think we are hearing that you are set, that it's going to be an urgent care, and then we will see how it will expand. I'm saying,
No.
why not go to the drawing board now? Why do it before? You don't add, because if you add, it's going to be people's lives lost from the time you build the urgent care, and then you have further plans. I think this is time to go to the actual drawing board and say the community, if community is the center of your business, to say the community is asking for something else, there is a need, let's do a professional assessment which probably already exists, and let's restart this plan.
Yes.
Thank you.
Before you answer that, I just want to say, because you said, in case that exists, we went to this, we applied for the ARPA funds that were made available that was supposed to help us here in this city. We applied for about $300,000 to do a community assessment to say exactly what was needed in this area, because we had not been provided of one before now. We were turned down for that.
Yes.
So we went to the city commission and told them how upset we were about that. So, you know, I said, we don't have money to just be able to do whatever we would like, but a community assessment should have been done before this happened.
I think this is the question that I would like to answer this. So I may come to the question is, what is prohibitive in taking this from an urgent care to a, what is prohibitive? Is it money? Is it resources? Is it labor? What is prohibitive? It's my question.
All right, so the question is, what is prohibitive? Our decision is, and we've gone through the process, the planning, we've got it approved, we're going to break ground September, October timeframe. We want to get this going, and I want to get it going now. I want that going right now. I think you start going back to a drawing board, it will lengthen the process. I'd rather get something going right now and build on it from
Just copy what you built in Beaver Creek. You got the plans, put the same building in. Real simple, you're done. Same thing, the space is there, the parking garage is there, there's no excuse.
Okay.
You have the plans.
We want to go ahead to our next person from the floor. State your name, please.
My name is Joe Singleton, and I'm from the Trotwood area. I don't have much to say other than I need to know why. Why, when we bring things to our community, it's always piecemeal. We get a little bit at a time. Why can't you do the same thing here that you do in Beaver Creek?
That's right.
UD, and the other areas?
That's right.
You're bringing in a very small building that's not going to really take care of our needs at all. Why can't you do the same thing?
Grace.
Thanks.
I know what it is, but I want to hear it.
So I disagree. We did do an analysis. We did look at what the needs are. We did sort of do a planning analysis on what needed to be there. We have pulled in multiple partners, and we're committed to that project.
How can you say that you did? How can you say that you did that when what you're bringing over here is much smaller than what you got at UD, Beaver Creek, Englewood, anyplace else? We've got more people in this area that you're going to be. We've got more people here than you're serving in Beaver Creek, UD, and some of the other areas when you bring us in a smaller building.
My name is Ethel Smith. I was the first nurse to graduate from the School of Nursing at Good Sam. And Good Sam was a beautiful hospital. That emergency room and the halls, it was just beautiful. I was a patient there right before they tore it down. I cannot understand why they tore it down. And we need another hospital up there. We do not need urgent care. So I hope that you'll be able to do something. Now I'll soon be 90 years old. And I cannot get health care. Miami Valley, they say, is overcrowded. So by the time I get it all the way the other side of town, I'll be dead. And I have given my life 40 years. I was a good nurse. When I retired, they said, look at all of the patients that these hands have taken care of. And now I want health care.
I want to give Mr. Reardon an opportunity if he wants to say anything there.
No, just thank you. My name is Tony Currington. Currently live in Harrison Township. I've spent 20 plus years in this community right over here on Kensington Drive. Great neighborhoods, lively, and very accessible to this hospital that we just lost. But I'm always reflecting on these maps. And this maps over here, redlining maps, it's perpetuated by, again, the hospital. If we follow the path of how these hospitals travel, they follow rooftops because there's always, they've gone from a business, I mean, they've just formed a business model to follow. And so that's what's talking, that's who we're talking to today, is money. And we have serious wants and needs, and nobody seems to listen. They just kind of tell us what they want to give us. And I think we're sick and tired of being told that each and every day. We're tired of waiting. Again, we get delayed and delayed and delayed about all the things that are crucial to this environment that's been destroyed through redlining. And we're still gradually recovering from that. We've lost a lot of vital, some of a major part of our population is a part of that, and we just want that to stop. You can do that. You can put the first foot forward to make that happen. I mean, you obviously advocated that you possibly did that in Chicago. It can be done here because at one point in time, this city of Dayton was the third worst racist city in the United States. We need to stop that. Putting our foot down for putting what we need, not what you think we need, but what we need in this community is a hospital that provides full services, just like they've been advocating here today about all the different hospitals that have been placed everywhere except in West Dayton. Right. West Dayton has been a catastrophe in regards to healthcare. They put all these different slaughter houses over here, dumps, things that are totally unhealthy that people, like I breathed when I was young, and I'm sure our generation after us is still breathing it. Major asthma cases, different all kind of cases that are generated as a result of the fact that we live in an area that's been targeted, purposely targeted for people of color. So what we do, what you can do is establish a new way of thinking and be the example that we would like to see, and step forward and say, look, enough's enough. Let's get the hospital built over here at West Dayton.
Amen. Mr. Reardon, any comment?
No, I hear that, and I love the idea of a new way of thinking. I'm going to do my part to bring that to date. Thanks, David, for speaking up. Appreciate it.
Thank you, Tony.
My name is Tim Bruce. I live in the neighborhood here.
A little closer to the mic, please.
Okay. I'd like to ask Mr. Reardon if the reason that Good Sam was pulled down was because it was not economic anymore. It was not a profit center in the way that the hospitals that are built in the suburbs are producing a lot more profits. I'd like to ask you if you consider Premier Health to be a not-for-profit organization. If that's the case, then surely there's a case for creating a hospital, is what everybody's been asking for, that serves this community. It's not going to make as much profit as the suburbs, you know, because there are poorer people here, there are people on Medicaid and so on. So it's not going to make as much profit as the suburbs. But can you not, allow for the possibility that you would have a facility that would, be the one I'm describing? I mean, you're supposedly a not-for-profit organization serving the community, and you're not serving the community here.
So 3 quick questions. One, yes, we are not-for-profit. That doesn't mean we can lose money. It just means we don't distribute to shareholders.
So the reason that Good Sam came down was because you're losing money.
Well, let me get to that one. I just wanted to give you sort of a status, a corporate status. The other one on the Good Sam, there were 2 parts of that. And again, a lot of this is me retrospectively looking at, and it's a decision I agree with. And I understand it was a difficult decision, but there was the cost of sort of getting the facility up to codes or standards. And then there was the duplication of services throughout the area. So for those 2 reasons, the decision back then was made to close Good Sam. And I agree with that decision, as difficult as it was.
Just 10 years prior, they had added a new wing to the hospital. What changed? What changed? I'm actually the regional coordinator for SPAN Ohio, the Single Payer Action Network Ohio, which is working for universal health care here in Ohio and across the country. And if we had Medicare for All in place, hospitals would be operating under global budgets. That is, money would be allocated to run hospitals according to the needs of the community.
Yes.
So if that had been in place back in 2018, it's likely that Good Sam would still be in place, still be up, working as a working hospital, because it would be subsidized by the global budgets that Medicare for All would. And I really hope that people support the idea of Medicare for All. I just wrote an article in the Dayton Daily News.
Sir, we are out of time, but SPAN, we are a huge supporter of SPAN, and SPAN is one of our...
has really supported...
Yes, SPAN is one of our organizations as a part of the CCC, and we are in support of the one payer, absolutely.
My name is Reverend Neil Geiser. I'm the pastor of Fairview United Methodist Church. I will be brief. Mr. Reardon, I just want to thank you for being here today. I appreciate you being here. I myself am new to this community. I've been here for just about 1 year now. And just in this short time that I've been here, our church is just a few minutes away from where Good Sam was. And so I have seen just in this short time how this has impacted our community. And I want to be fair, but I'm hearing you say that, you're going to be building this urgent care. But then you are speaking in more generalities than in specifics. You're hearing the people say that they don't want an urgent care. They want something more. But then you're also saying that you will evaluate, we'll wait and see. We'll see if it's going to be successful. If it's going to be successful. So once again, these are generalities, and I think the people here need to hear something specific. What is the criteria of this being successful and then warranting something more?
So I think it is both, and I understand it's difficult. I'm asking you to sort of hold the specific, because we are going to go ahead. We're committed to that project, and I can't, because I don't have the information to go beyond the generality. I do not know what the utilization is. I do not know what the impact of the other partners, the economic development impact will be on the community. My hope is it's very positive. I like the plan, I like where it's going, and I think it's going to be built, or something we can build on, but I don't have anything other than that.
Yes, my name is Imam Abdul Shaker. I'm here representing Al Musaddin Islamic Center, and I've worked with the coalition in the past. But I'd like to know, just as briefly, why don't you just put the land up for sale? Let's some people come in and want to buy the land and want to do what the people want them to do. You keep holding on to this land and you keep coming up saying what you're going to do, but it's not what we want. Put the land up for sale, and then you'll see what happens then. Thank you.
I have maybe just a short answer, because I don't want to leave West Dayton. And I can hear you say before you left, well, we're going to come back, we're going to be part of that community. I want to be part of this community, and I want to take this project to sort of starting, fruition, and to make those generalities specific and move forward. That's why.
Good evening. My name is Rosemary Peters Brain, and I'm a lifelong Daytonian. Reverend Carter is my pastor, and I can say that his life story is one that exemplifies the need for a full-fledged hospital in our area. A few years ago, he had an emergency. Luckily, he lives within blocks of where Good Samaritan stood. If he had not been able to reach a full-fledged hospital within 2 minutes, he would not be here today. I am not exaggerating. We would not have him sitting here with us if he had to travel to Miami Valley Hospital. We can't wait 2 years to get a hospital in our neighborhood. We need it now. The need is now. It happens all around us. We know it can be done, and I understand the dollars and cents of having a majority of a lot of your patients on Medicare. I understand that. And so affluent areas get the hospitals. I can't think of any other reason that we do not have similar facilities at Beaver Creek, Inglewood, Vandalia, you name it. Every other little small community around here has a hospital. Not urgent care. We don't need that. We need a hospital, and we need it now.
I have Joe Love.
I have a statement and a question. My statement is that you feel like a figurehead up here just bouncing and acknowledging and not actually listening to what we're saying. And that's also very disheartening because you are actually in a position to make this change. I understand that the wellness center is a partnership of different collaborations. The premier specific thing that they're going to put in is an urgent care, is lab imaging, is PT. So you have the ability to change that section that you guys are providing, not the collaboration. I'm not talking about YMCA and what they're putting in. I'm talking about Premier Health. And what you guys can offer to this community is more than just an urgent care. So my question is, where is this assessment that you guys did? Where can we find this information? Because I would like to see what exactly the community said and how you came to your decision, as well as, are you actually going to take in what we're saying? Because if not, why be here? Because it's also insult to injury.
So thanks for sharing your story about me. But I am listening. Every time I've had an interaction either with Dr. Worthen or members of the clergy, to include the time at one of the meetings where they actually laid hands and prayed. For a Catholic boy, that was a powerful experience. I went home and talked about it. So I am listening. My body tells me when I'm listening. You know, my heart has been racing, my stomach has been, my eyes have felt pressure because there were so many sad stories. So I guess I just want to say I am listening to it. And I will just tell you, it must have impacted me upset because I sort of have lost the question because I was just so concerned that your perception of me, and that's good feedback, that I'm here as a figurehead and not this.
Where is this assessment that you
Oh, so I think if you go to the Phoenix Next website, that will step through what had been the process to get to that decision.
So I have seen that that's the assessment that you're basing it off of, and it's insufficient, it's incomplete, and the statistics don't line up with the actual information that they got from the community. So is there an attempt to actually do a proper assessment, or are we going to base it off of inaccurate and insufficient information?
We're going to base it off that assessment.
We're going to take the last four from the floor. And let me say before, we're not going to let it go at this. Please know, I can't speak for Mr. Reardon. I can't speak for the clergy, and I can speak for the community. As we watch neighborhood after neighborhood, urban blight, decay, violence, divestment throughout our black neighborhoods, we have to stand up and say enough is enough. So we're trying to do it as nice and peacefully as we can here. But as we watch the devastation across our nation, and as people try to convince us that somehow we have misunderstood the situation of the inequities and inequalities that are going on, no justice, no peace.
Hi, so my name is Casey Goff. I am 27 years old. So
Get the mic a little closer to your mouth.
I'm a little short, y'all. So my name is Casey Goff. I am 27 years old, and I don't necessarily know that I have a question for you. It's more so I am here because this is important to me, and I feel like you should know why I think it should be important to you. As a 27-year-old woman, all of my friends are having babies, right? When Good Sam was here, my friends were having babies. I saw my best friend, she was able to walk to get the prenatal care that she needed because she didn't have access to a car. Uber and Lyft were not a thing. Those are things that we are now missing. That's important. As a 27-year-old woman, I've come to multiple town hall meetings about this. I've been to the protest, and I've seen the response from Premier Health. And what I got from that was, Premier Health does not care about me as a 27-year-old black woman. So I left. I went to Kettering. And when I talk to my peers, when I talk to my family, do I tell them to go to Premier Health? No, because Premier Health does not care about black women. That's what I got out of that. And that should be important to you, that is the message that you guys are sending.
Hey, my name is Christopher. I'm from the area, but I'll say my question first. Why do we keep hearing Premier so opposed to anything here besides a Band-Aid facility in a YMCA? When I look at your guys' map of where your facilities are, it's all up and down 75 and I-70 and the highways. You guys are just moving to the highways everywhere and where the money is. So we know what y'all doing. So when y'all bought this from the Sisters of Charity, you basically swindled out of them because they end up suing you guys right afterwards and everything, just like y'all did with the St. E. So you're replacing a great medical facility with this Band-Aid center. You know, you have Miami Valley North, Miami Valley South. We need maternity up this way. We need urgent care, and we need emergency room up this way. For this whole Northwest, actually beyond, when you go up to Brookville, they was coming here. Eaton was coming here. All that northern area was coming all the way down here. You're saying duplication of services. There's not duplication of services. They need it up here, not to go down to Miami Valley where it's crowded, or go to your competition at Kettering. Because I would go to Kettering before y'all. I mean, I had my baby down in Kettering. I wasn't going to Miami Valley. I would have had a Good Sam like I was born in Good Sam. And I didn't even live in Dayton when my parents brought me up here. We came to Good Sam, just like these people from these other counties, because that was the better facility. It was better than Miami Valley. So.
I think that the additional question was why opposed. I'm not opposed. I'm open. I just think there's a seat to get this current project up and going.
Hi, my name is Marva. And
I'm sorry, Sister Marva. Gonna take Reverend Cunningham and then Mr. Gray.
Kimma Cunningham. One of the things that is really interesting to me is that for those of us who have health care and access to health care, one of the things that they always tell you is you don't want to go to the urgent care. Number one, urgent care is more expensive. Urgent care doesn't have the kind of services. They end up sending you somewhere else anyway. And so the reality behind you all over here needing urgent care, I live down on Dorset. So I'm right down the street, and I think the issue is that's not the case. Whoever knows anything about healthcare, whoever knows those things about how insurance works, knows that it is always, the doctors tell you always, you don't really want to go to the urgent care. You don't want to go to an urgent care. It is, and the issue around how we use in the African American community, as we educate ourselves and educate each other about how we should utilize our healthcare system, it is always an issue where you don't use certain things as the ER. You don't go to certain places. You want to use it wisely. You don't want to take, somebody mentioned earlier about taking an ambulance somewhere, and the fact that they really didn't want to go in the ambulance because it would cost too much. That's something that in this country we shouldn't have to worry about. We shouldn't have to worry about it. So, I think the issue with the whole notion of an urgent care is antithetical to what the Black community needs anyway. The hospital is what we need, not an urgent care, because an urgent care doesn't meet the overall need.
I'm from the neighborhood around here, and when me and my neighbors talk, none of us have ever been evaluated or asked what we want. Amen. So we don't know how wide when they always say, we talk to the neighborhood, and we don't know what neighborhood you're talking to or how wide you go. But one of our concerns was that, are you pushing the urgent care, because you will have premier doctors at that urgent care, therefore your premier doctors will push people to Miami Valley away from Grandview. So you don't really want to, you don't want to leave all of our money, because yes, this is a lower income area, but we do have power of money because Medicare and Medicaid, you get a lot of money from them, because Good Sam, from what I hear, was not in the red, and Good Sam made a lot of money. So is that your purpose? And also, since Miami Valley, people have moved to Miami Valley. People who I know who are being pushed to Miami Valley, they're not getting a good experience there. So that's something that you can work on now. Because to me, it's like the sister said a while ago, when you go to every area except for our area, you send a message to your employees that we're not important. And so when we go to your hospitals in those areas, they treat us as though we're not important. And that you can work on now. And also, I want to know, when you see the statistics, they speak for themselves. How do you feel about when you see 87% white, 6% black? How do you feel? Do you see any disparity in that? What is your thinking? Do you see any unfairness of it? Thank you.
So I heard three things in there. One I want to address. One is the experience, patient experience. To the extent anyone in this room has had a less than favorable experience with Premier Health physician, facility, administrator, I want to apologize. And you are absolutely right, I own that. And that is something that I will work on, and I'm sorry if that has been the experience of anyone here, and this is a priority of mine. As for our physicians will direct patients to the place and the facilities they think will provide the best care. They are a dedicated group of physicians, and I trust them. And how do I feel when I look at that, these other statistics and the other places? I feel like I'm here right now, and I'm going to continue to push to put in Northwest Dayton, starting with this this facility and these services, and look to build from there.
Go ahead. Right here in the middle.
Hi, Mr. Reardon. My name is Yvonne Currington. I am a retired RN. I spent 45 years in this community working at various hospitals, 16 years rather in the ER at Good Sam, 7 in the ER at Miami Valley after that. I can tell you that I can't imagine how you could expect that an urgent care of 12,000 square feet is going to meet the needs of this community. And I'm wondering, since the impound laws make it so that urgent cares don't have to see everybody who shows up at their door like they do for an emergency room, when you have a car pull up at the door and as they're pulling off and honking the horn and pushing the body out because they've been stabbed or shot, that happened plenty of times when I worked in the ER there. What's going to happen to those people? Because your urgent care can't take care of those people. You can't deliver a baby at an urgent care safely, anyway. Insurance company, Medicare and Medicaid, most urgent cares don't take those patients in the first place. They don't see. So is your urgent care going to see Medicare and Medicaid and self-pay patients?
Yes.
That's good. But it's not enough. This community deserves, and it's all about money. I mean, I worked in the ER at Miami Valley when a group of physicians, surgeons moved, opened a wing over at, or a unit over at St. E's and took their private pay surgery patients over there. And Miami Valley leadership about went into apoplexy over it. It's like, oh my God, you're going to leave us with your self-pay, and you're going to take all your private pay patients to St. E's? How can you do this to us? As much money, Premier's what, a $1.9 billion entity? That was the last I heard. Biggest in this area. In all the years that Good Sam sat on the site that it was on, all the money that has been siphoned off the community because it's a not-for-profit. And you can't leave some sort of a full-service hospital and emergency department so that people can get the care that they need. It makes no sense. You could write it off, it seems to me, if you're losing money. And by the way, your urgent care, when you don't get enough patients paying for it, with insurance, then what are you going to say? Well, it's not successful, not enough people are showing up, so we're going to close it down. I mean, I just can see so many things happening here. and it is a crime, and it needs to be. I want to know what you're going to do about that.
Okay.
I want to know why you aren't going to build a hospital here. Why you would let another entity, because you don't want competition. That's what it's all about. Just like you said.
Sister Kathleen?
Thanks for coming. As they said earlier, Mary Busalis never really responded to the Clergy Community Coalition in any way, shape, or form. But most of us have heard the system is rigged. We heard it from Martin Luther King. We heard it from Malcolm X. We hear it from Bernie Sanders. I attended those Phoenix Next meetings. Those were rigged.
Amen.
Those were rigged. They were not allowing people to ask questions or suggest a hospital. The civil rights complaint, the federal complaint, I had the honor of working with this incredible Clergy Community Coalition team, going around and talking to over 400 people in these neighborhoods, knocking on doors. I get caught up in people's stories. Sometimes I'm not getting the paper signed because I want to hear the people's stories. And you have people in this community hurting, who were angry, who know that right now Premier is throwing this neighborhood a bone. And I want to ask you, if you think this is rigged, the head attorney, or one of the head attorneys for Premier, was Leon Rodriguez, the former head attorney for the Office of Civil Rights within the Health and Human Services. So the very agency that we sent that federal complaint to, Premier's, one of their head attorneys, had been the head attorney for that agency. That Leon Rodriguez knew where to turn the screws. He knew how to turn that federal complaint inside out. The system is rigged. And sir, I want to ask you, when we went around and collected those 400 testimonials, people want a hospital, as you can hear from everybody in this room. You can prove in 2022 that the system is not rigged, but it is. Unless you really work hard and give this neighborhood what they are asking for, again, the message, the system is rigged. Sir, I want to ask you, I grew up Catholic here in Dayton. I grew up with nuns across the alley, priests across the street, went to Catholic schools for 12 years. That Good Samaritan statue meant a lot to me. That was the message I got from the Catholic Church, that we are here, and it's my core values, and it's the core values of CCC, that we are here to take care of one another. Sir, I want to ask you, as a CEO of Premier, and having religious and spiritual beliefs, how do you integrate your beliefs into that multi-million-dollar paycheck that you got, sir? How do you integrate that?
One meeting at a time. Just like today.
At $2,000 an hour.
My name is, I'm Dr. Matthew North A. Jones. I'm a primary care doc in North Dayton. And I think it's inspiring to see all the people here, and thank you guys so much for the stories. And I think the stories are really important. But I think sometimes they're easy for people in business to blow off because we're like, they're just stories. But you don't even need that. We know that this part of Dayton has the highest infant mortality rate, the highest rate anywhere in the area. Like that wonderful woman who was up a little while ago, she's not wrong. It is dangerous to be a pregnant African-American woman in West Dayton, and that is not okay. I know, like, there's not a lot of, unfortunately, doctors who speak out because we live in the system, right? But I'm here because we need to help our patients, and I know that a lot of people at Premier are here because they need to help their patients too, right? And you know, the worry I have is the same that that Ms. Currington brought up, is that you've already know the numbers. We had Good Sam here for decades. So when you say that maybe things will change when we get an urgent care and we see how much it's used, we know how much it's going to be used. It's gonna be like it was. I mean, like, it's not gonna be as good, obviously, but what we're seeing is the same worry that somebody else has already posed, that this is just gonna be an excuse to leave it exactly like it is, because you're gonna put out numbers that say, it's not being used enough, people aren't, needing it or whatever, but all of these people here show you different. And I don't think you need more numbers than that. I don't think you need more numbers than what we already know about the statistics of health in this area to be able to justify building the facility that we need. Would it have been better to have kept the old one? Obviously, you can't undo that now. But at least give the minimum that we can do to keep people alive. Thank you.
Hi, Mr. Reardon. My name is Tiffany. And my question is, of the 40,000 people that live in this community, how many go to Premier for primary care services, for urgent care services, and emergency room? If those 40,000 people were to leave Premier and go to other networks, whether it be University of Cincinnati, Cleveland Clinic, OSU, what would happen to your organization then?
I don't know the specific numbers. I would imagine it's a large majority, and I want them to come back.
You still didn't answer the question though.
I don't know the numbers. I don't know how many.
But what I'm saying is, if people in this community stop using Premier across the board, what would happen to Premier?
Oh, I think that would be bad for us and bad for the community, because I think we're a good provider, and I think it would hurt us financially, it would hurt us from a care standpoint, it would hurt this community.
Thank you.
Again, I want to thank the senator for being here and coming for dialogue. My name is Charles Williams. I'm clergy. Matter of fact, I have the honor of also serving here at College Hill with Pastor Worthen. I lived for 22 years in Dayton, and matter of fact, lived right in the back of Good Samaritan Hospital. That was one of the reasons why I bought that house. I was on faculty at Sinclair. I presently live in Beaver Creek. And right now, I feel a lot of anxiety. I have a lot of conviction that I'm listening to all of these testimonies. And I live in a blessed community of healthcare, a privileged community of healthcare. And I'm feeling that conviction. The point that I want to bring up, I remember and watched that emergency facility in Beaver Creek. I watched it grow up. I watched it be built. And I was befuddled. I said, why in the are they building this in Beaver Creek? I said, right down the street, we have another urgent care. It's not Premier, but it's an urgent care. It's less than a mile away, right down the street. I said, why are they building that here and closing Good Samaritan Hospital? But now one of the things that I've learned here in listening and being educated, that is a 17,000 some square foot facility, correct? In Beaver Creek, that emergency facility, right? 17,000 some, that's not an urgent care. That is an emergency facility. Now, I don't know, sir, I listen to 107, Mix 107.7. I listen, and they're constantly advertising that facility. And they're advertising all these services that are available. And one of the things I never understood was, why did they build that emergency facility? Soin is right down the street. And so many people have gone to Soin, and I've been to the emergency room in Soin, and people have nothing but praise for the emergency room at Soin. So why was Premier putting this facility in Beaver Creek, and you got an urgent care less than a mile down the road? I guess there was and all.
Bring it to a close, Doctor.
Yeah, okay, and I'm gonna do this. All the services they offer sound like the same services you can get right there at sewing. You were talking about duplication of services. They sound like the same services. It seems to me that maybe why that was put out there was to set up competition with sewing. And there wasn't a community need that was assessed to have that put up there. They actually wanted to compete with the emergency room at sewing. Now, we talk about a needs assessment. I don't see how that needs assessment says that we in Beaver Creek needed the 17,000 square foot emergency facility.
Amen. One more from the floor, Dr. Georgia.
Hello, my name is Dr. Georgia Alexander, and I serve under Dr. Rodney Carter, my double doc. And I also have lived in this community for 51 years, 25 down south of Philadelphia, and 25 over in back of Good Samaritan. I began my chaplaincy training at Good Samaritan. I moved to Atrium Medical Center, back to Miami Valley main campus. And I heard my pastor say, you had some $30 million that had been allotted to, and he referenced the fact that $30 million was enough to build a facility over an emergency room over there. And I started looking at the board, and these facilities were like $4, $5, $9 million. So with $30 million set aside, what happened can you explain to me in kindergarten terms why you couldn't put an emergency center or a better facility over here? Now, the Samaritan has served me well. I've been a patient there, been a patient at Atrium, been a patient at Miami Valley at Premier North, and a patient at Premier, the main campus. But I do need to know, or I'd like for you to just break it down to me. I kept trying to hear, why, if you got $30 million, you couldn't put a facility right back over here? Good Samaritan was a beautiful facility. I'm from the South, and I would go 2 or 3 times a year. When I would come up my 75 North, and I would see that beautiful building on the skyline, I knew I was nearing home. I'd wake up. I'm almost there. It left a beautiful picturesque skyline. They built another wing, a cardiac wing. Then at Christmas time, we had the most beautiful decorations out on Salem and Philadelphia. I just wonder how you just broke my heart and you got $30 million.
I'm not sure where the 30 million is.
I just heard him say
15 million pledged by the city, 15 million pledged to Phoenix Next.
Yeah, so Premier Health, so our amount was $15 million, and that is, we are working with Phoenix Next on that project, and those dollars will be spent as part of the Phoenix Next.
Well, then I saw some of the buildings, some of the emergency facilities costing like $9 million, $4 million, $7 million. That's just what I am kind of perplexed about. So thank you very much for listening.
Okay, I'm going to read one more. If you believe this urgent care has so much to offer, why didn't an urgent care suffice for Monroe, Liberty, Beaver Creek, UD, or Springboro? How would you feel if your mother or father, your wife or children, or you yourself had a life emergency and all you had access to is this urgent care that's being proposed? Can you stand here with truth and sincerity and tell us that this urgent care would be enough for you enough to make you feel safe for your family, enough to save your family's life.
I think it's enough for a start back into the community. No, I don't know what else to answer.
Would you send your family with whatever's going, if you lived, let's say a block from Good Sam, like many of these people live blocks from Good Sam, would you send your family with a stroke after having a car accident, being shot, having a cardiac episode? Would you send them to this urgent care? Would you feel good about the length of time it would take them to get to a hospital that has the trauma level trained response team to handle them?
Dr. Worthing, may I make a statement? Mr. Reardon, I really don't think you understand what this community is asking you. And I think you're underestimating that you got all these pastors sitting up here. But you sound like the White Citizens Council did in Montgomery when Dr. King was desegregating the buses. You sound just like they did in Selma, Alabama under Jim Clark and Bull Connor in Birmingham. Don't you underestimate this community. We don't want an urgent care. We're telling you don't want an urgent care. We're going to organize this community. You're not going to put an urgent care there. It's a shame that you could come into an African-American church, stand up before these people, before God and everybody else, and ignore his children who are hurting. And as a clergyman, I'm not going to let you get away with that. This is smoke and mirrors. We see through this. We are angry about this. We're not going to let it happen. You better take a good look at all these pastors sitting behind you and all the congregate members that we can organize in this community. An urgent care at the old Good Samaritan site and a YMCA, and I don't care if the city did endorse it. The people didn't endorse it, and it's not going to happen. Don't underestimate this community, and don't underestimate the clergy community coalition.
Okay, with that, I just want to say we're going to let Brother Bill have a word, and then that's going to be the last one from the floor. We did watch as it was announced about the the facility on Brown Street, and when the community was in arms about that proposal, and it came to a screeching halt when that neighborhood said, we don't want it to happen like this. It got put on hold until you came up with a proposal that satisfied those citizens and are now moving forward. What we're saying is, why can't you put a screeching halt to this? Find a compromise that will work. And we say it's a huge compromise to let 2 million square feet go and replace it with less than 100,000 square feet. When $15 million was pledged by you, $15 million pledged by the city, we know that the money exists. We also know that our money is as green as anybody else's, and if we choose to take it someplace else, there are two health networks in this city, Kettering and Premier. So you can do with this what you would like, but we're trying to work with you. We're trying to speak to you as a new CEO to say you can right this wrong. You can hear the community outcry and make a difference. Maybe you won't announce it tonight, but hopefully you can go back and talk to your people and say, this is not going to work, we've got to do better.
Thank you for allowing me to take a few more minutes here. I couldn't possibly say all I could say, but I just want you to know that you've gotten yourself into an organization that, well, I was hired by Good Samaritan in 2007, and I worked in IT for Premier until I retired in 2016. And I was appalled at some of the practices and the office politics and the wasted money on the computer systems sold by Epic and all the integrations from different departments. And I think the company meant well, but I don't think in the overall scheme of things, they made some very good choices. I think they wasted millions of dollars training people to do stuff that never happened. And I could go on, but I want to say for everybody that is here, that in case you're not aware, we don't pay for health care properly. We have a patchwork of programs. We have a sick care non-system. We have different government programs paying different rates that don't always cover costs or just barely cover costs. What we really need is to get rid of the insurance companies so that they don't take a cut off the top. And we need to give our government the power to negotiate all prices, not just do a better job on drugs, but all prices, whether, and global budgets were mentioned, but I think we can expect, or we should expect, I would think that everybody in this room would expect that Premier would kick off an effort to educate people on single payer instead of being a member of GADAHA or the Ohio Hospital Association or any of the other associations that actively work against single payer. I can't imagine why Premier would have a problem with implementing a system of income for them that would actually increase longevity and lower infant and maternal mortality.
Okay.
You know, you can go through all the studies that have been done over the years. You know, there's a
You've got to
mission.
wrap this up.
Okay, there's a mission to improve community health. Premier has not moved the needle on that for decades. Thank you.
Amen. I wish we had more time, but I want to thank Mr. Reardon for taking, I'm going to give you a few minutes. Okay. I want to thank Mr. Reardon. We want to thank him for coming out because he listened. The first thing is to hear, to speak, but the second thing is to know that we can't leave this here. You've got to tweet it, you've got to forward it, whatever you can do to make this information available. I want to acknowledge our city commissioners again, Commissioner Fairchild, Commissioner Turner-Sloss, and Commissioner Shaw, who signed on in support of a new medical center on with the CCC, for all of the pastors who led this and signed on to do this, for all of you who came out. Tell your neighbors, tell everyone, that's the only way that it will make a difference. It is the voices of the people that will make a difference. Before we leave, we have petitions that you can sign, a letter that you can sign, and for every person who has attended, you can get a yard sign, and we ask if you feel so inclined for a $5 donation, but either way, or more, but either way that you can leave with a sign, and please, if you would put that in the lawns of your houses and your churches. And with that, I'm going to ask Reverend Carter, if you would pray. Just pray, not talk, just pray. And then we're going to have a song, and then you can get your signs and your sign on to the petitions, and we will get you out of here.
Offering, please. We really need $5 from everybody here if we can do it.
You can also do a scanner code. We have that you can do electronic pay with the Q bar, or if you have the cashier for a sign to continue to support.